guys, and welcome to Hari Gastro. In today's video, we'll be talking about quite an interesting pathology, and that is type 1 diabetes. So let's get started. So what is type 1 diabetes? Type 1 diabetes, which was once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas of the body loses its ability to make insulin. This occurs because the body's immune system attacks and destroys the specific cells in the pancreas that produce the insulin. These cells are called pancreatic beta cells. So what essentially happens in patients with type 1 diabetes is that they have a normal functioning pancreas, but they have an overactive immune system. So the immune system actually is triggered by the beta cells in the pancreas, and it recognizes them as being a pathogen or an invader or something foreign, and it goes to destroy it. So in doing so, it actually destroys these beta cells. And these beta cells are important to us because they make the insulin in our body, which means they're involved in blood sugar regulation. So if we take a closer look at this image on my right, we see that when we ingest the food, it goes into our stomach, and our stomach actually converts the food we ingest to glucose, which is the main energy source for all our bodily functions. The glucose then enters the bloodstream, and the pancreas here will usually respond by making insulin or producing insulin. That will enter the bloodstream as well and decrease the amount of glucose, because we can't have huge amounts of glucose floating around in our blood. It's not healthy for us. So that's normally what happens. But in patients who suffer from type 1 diabetes, because the pancreatic beta cells are destroyed and the insulin is made in the pancreatic beta cells, the pancreas produces little or no insulin, and therefore little or no insulin enters the bloodstream. The glucose starts to build up in the bloodstream, and the glucose levels will begin to increase quite rapidly. So this is basically what type 1 diabetes is all about. Now let's discuss the genetic association with type 1 diabetes. So scientists are unsure exactly why type 1 diabetes occurs, but research has proven that it has something to do with our genes. Patients have a greater risk of developing type 1 diabetes if they have specific variants of the HLA-DQA1 gene, HLA-DQB1 gene, and HLA-DRB1 genes. These gene variants are responsible for the body's own immune system attacking the pancreatic beta cells. So the immune cells, which usually help us fight against harmful bacteria and viruses, mistakenly destroyed the insulin-producing pancreatic beta cells because they recognize them as a threat to the body. So if we take a closer look at this image down at the bottom left of my screen, we see that this is actually what the pancreatic organ looks like. And if we look at it under a microscope, so if we take a section of it, a cross-section, and look at it under a microscope, we see that we have these beta cells, which are actually the ones that are responsible for producing insulin. But in patients who have type 1 diabetes, this is what their pancreas actually looks like. We see the beta cells that are there, but they're actually all destroyed. So once they are destroyed, they lose all function, and therefore they can't produce any insulin. And if they can't produce any insulin, they can't decrease the blood sugar levels. Therefore, the patient has increasing blood sugar levels. So what are some signs and symptoms of type 1 diabetes? So signs and symptoms in type 1 diabetes usually appear pretty suddenly and may include increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during the nights, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, and also blurred vision. Now let's quickly talk about the complications of type 1 diabetes. So patients who have type 1 diabetes may also suffer various complications to other organ systems due to that high amounts of sugar in the blood. So these patients can suffer from heart and blood vessel disease, which is referred to as diabetic cardiomyopathy. And these patients suffer from various cardiovascular problems, including coronary artery disease with chest pain, which is called angina, heart attacks, strokes, the narrowing of the arteries, which is called atherosclerosis, and of course high blood pressure. Diabetic patients may also suffer nerve damage, and this is called diabetic neuropathy. And this is when the excess sugar in the blood injures the walls of the capillaries that supply our nerves, especially in the legs. This causes local tingling, numbness, burning, or pain. Patients can also suffer damage to the gastrointestinal tract, and this causes nausea, vomiting, diarrhea, and constipation. For men, erectile dysfunction may also be an issue. Continuing with complications, diabetic patients also suffer from kidney damage, and this is called diabetic nephropathy. And this is when excess blood glucose levels damages the delicate filtration system of the kidney. Diabetic patients can also suffer eye damage, and damage to the blood vessels of the retina, which is called diabetic retinopathy, may potentially cause blindness in these patients. Diabetic patients also have a higher risk of cataracts and glaucoma. Diabetic patients may also suffer foot damage, which is called diabetic foot. The feet suffer nerve damage and poor blood flow, which increases the risk of cuts and blisters, which are prone to becoming infected and may result in a toe, foot, or leg amputation. And finally, some skin and mouth conditions. So diabetic patients are actually more prone to bacterial and fungal infections, as well as gum disease and dry mouth syndrome. So how can one go about diagnosing type 1 diabetes? So the first thing we can do is a glycated hemoglobin test, which is measuring the levels of HbA1c or the A1c test. So the A1c level of 6.5% or higher on two separate tests is indicated for diabetes. We can also do a random blood sugar test. So a random blood sugar level of 200 milligrams per deciliter or more is indicative of diabetes. A fasting blood sugar test can also be done, and a fasting blood sugar level of 126 milligrams per deciliter or higher on two separate tests is indicative of diabetes. Treatment. So the first thing we can do is give the patient some blood sugar altering medications. So the doctor may recommend insulin or some oral glucose lowering medications. We can tell the patient to exercise because physical activity can use excess glucose in the blood. However, if a person with severe hypoglycemia finds ketones in the urine, they should avoid exercise, as this will break down more fats and might speed up ketoacidosis. Patients should also moderate their diet, so that means eating less during meal times and snacking less, as well as focusing on low sugar foods helps to keep the amount of glucose at a level that the body can handle. A dietitian can also help a person adapt their diet in gradual and healthful ways. So as we see in my bottom right of the screen, we have the type 1 diabetes pyramid. So the first thing is the insulin use, the diet regimen, so following a strict healthy diet, regular physical activity, as well as close monitoring of the blood sugar level daily. So now let's talk a bit more about insulin. So there are four main types of insulin. We have the short-acting insulin, which some examples are Humulin R and Novolin R. And in this little graph here, it's shown in yellow. So this is the regular or short acting. So it says it starts to work 30 minutes to an hour after use, and it peaks at 2 to 5 hours. So this is the intensity. So this is usually administered to the patient before a meal in the morning. We then have rapid acting insulins, and some examples here are glulisine, insulin lispro, and insulin aspart. And this is shown in red on my little graph here, and it says starts to work 5 to 10 minutes after use and peaks at about 30 to 90 minutes. So if a patient checks their blood sugar level and they have a really high level, we can give them a rapid acting insulin. We then have intermediate acting insulins, and this include insulin NPH, which is Novolin N or Humulin N, and this is usually given before the patient goes to bed, because as you can see, it's got a long active duration period. So that's to keep the sugar levels from peaking over the night. And then we have long-acting insulins, which are also given usually to the patient just before bedtime. And examples here are insulin glargine, insulin detamir, and insulin degludec. And this is also a long-acting insulin, which starts to work 1 to 2 hours after use, and it doesn't peak. So it just sort of has a gradual plateau. And that brings us to the end of this presentation on type 1 diabetes. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. If you would like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.